Hello again, Southern Louisiana. Justin Owen here, your friendly neighborhood neurosurgeon with Disc of Louisiana. So for many years, I've been aware of a reputation that spine surgery has earned just in general in the population. And this gets brought up to me very often, both personally and professionally. And that reputation is that spine surgery should be avoided and that it never makes somebody better. This is a pretty interesting thing for me to hear, because I can tell you that in my job, in my daily practice, if I couldn't make people better by doing spine surgery, I'd either be out of a job or very dissatisfied with my job. And neither of those things are true. And so I thought that I would take a couple of minutes to kind of dispel or address the rumors about spine surgery and maybe describe some of the ways that myself and my partners at Disc of Louisiana are so successful in bringing people relief from their chronic pain by doing spine surgery. I think it really boils down to three things, what I call the three INGs, I-N-G-S. And those are understanding, planning, and doing. So the first thing, understanding, really boils down to knowledge and expertise. Many people think that we can see abnormalities on an MRI or on imaging that automatically means that they need spine surgery. But just because you have degenerative disc disease or even a bulging disc does not necessarily mean that that's the source of your pain. So when we meet patients in our clinic, we listen to the way that they describe their pain, and then sort of like Sherlock Holmes in a mystery novel, we try to use our understanding of the process of pain and anatomy to form a hypothesis in our mind of what might be causing that pain.
Compelling.
And then we look at the anatomy and see if we can find an abnormality that correlates closely with that. The best outcomes from surgery when we're trying to relieve pain comes when there's a very close correlation between a specific anatomical abnormality and then a specific pain that a patient describes. And if we understand that and then we can see that on the imaging, that gives us the best chance of being able to provide somebody with good relief. So the first stage of the process is really having an understanding of what's going on, both what the patient is telling us and describing to us and the anatomy and the physiology that we have learned separately. So then once we have a good understanding and a hypothesis in our mind, then we move on to the planning stage. Once we've identified the anatomy that needs to be corrected, then it becomes, how are we going to fix that? And this is sort of like when an architect is going to design a building in advance. You know, no one shows up on a construction site and just starts pouring concrete or hammering nails into wood. So an architect is going to design the home in advance, and that's much the same as what we're going to do with surgery in advance. We look at the anatomy, we decide how we're going to change the anatomy the way that we want to bring the relief, and then we plan the surgery. And really, I would say that 90% of being a good surgeon are those first two steps before we ever make it to the operating room. Then the third ING is doing the surgery. Doing is the third part. And so once we've got a good understanding and a good plan in place, we actually execute the surgery. And we take the patient to the operating room and we fulfill our plan and do what it is that we set out to do. And if we've done all of our job correctly, then we're able to bring people relief. And I think those three INGs is why we at Disc of Louisiana are so successful from a statistical standpoint in bringing people relief from their chronic spine pain, whether it be the neck, the back, sciatica, radiculopathy, whatever it may be. I hope this makes sense and addresses some of this issue. As always, I remain your friendly neighborhood neurosurgeon with Disc of Louisiana. If you have any questions about this or any issues that we think we might be able to help you with, feel free to give us a call on the number on the screen or leave comments below. Thank you and God bless.